Welcome to the Deep Dive, where we try to unpack complex topics and make them understandable fast. Today, we're diving into something that hits a huge part of the agricultural world. It's often unseen, but the consequences. Immense, both economically and for animal welfare. Our focus is calf pneumonia. You might also hear it called enzootic pneumonia or bovine respiratory disease, BRD, specifically in young calves. And look, this isn't just a calf with a bit of a cough, right? It's actually the number one reason for poor performance, poor growth, and even death in calves from weaning all the way up to about 10 months old.
What's really striking, I think, is just how complex it is. We call it multifactorial.
Mm.
What that means is it's not, one single germ or one bad day causing it. Instead, it's this complicated mix, this interplay between different infectious agents, viruses, bacteria, and then the calf's own immune system strength,
Yeah.
plus all sorts of environmental things and management stresses.
That really explains why it's such a tricky, persistent problem for farmers. So, our mission today is to really dig into the crucial knowledge from our sources. We want to understand the causes, how you diagnose it, what treatments work, and maybe most importantly, how to prevent it. By the end of this, you should have a real shortcut to being, well, properly informed on this critical subject. Okay, let's get into it. Understanding the multifactorial nature of calf pneumonia. So, okay, to really wrap our heads around calf pneumonia, we have to start with that idea you mentioned. It's never just one thing. It's like a combination of hits that weaken the calf's defenses, right? Kind of creating a perfect storm for the disease.
That's a really good way to put it, actually, a perfect storm. Typically, what we often see is a primary viral infection gets in first. This virus, it actually damages the lung's own defense mechanisms, the little hairs, the mucus layers, and once those defenses are down, well, it just sets the stage perfectly for a secondary bacterial infection to move in and cause the really serious illness. The common viruses doing this first hit, you've got bovine respiratory syncytial virus, BRSV for short. Then there's parainfluenza 3 virus, PI3, and infectious bovine rhinotracheitis, IBR, which is actually caused by a herpes virus, bovine herpes virus 1. Oh, and we should also mention bovine viral diarrhea virus, BVD. It might not directly cause pneumonia always, but it suppresses the immune system, making the calf weaker overall and more susceptible to everything else.
Okay, so these viruses are like the opening act, weakening the defenses. What bacteria usually come on stage next? The ones that cause the main problems.
Right, the secondary bacterial invaders. Well, the most common one we see is Mannheimia hemolytica. This one's actually a primary bacterial pathogen, too. It caused trouble on its own, and it's known for causing a really severe form called fibrinous pleural pneumonia.
Vaprinous pleural pneumonia, that sounds nasty.
It is. It's a serious inflammation of the lungs and the lining around them, the pleura. Causes a lot of scarring, makes breathing really difficult. Then you have Pastorella multifida. That was more often linked with bronchial pneumonia inflammation, more focused in the airways, the bronchi, and the lung tissue itself. We also see Staphylococcus somni. And another important one is Mycoplasma bovis. Now, Mycoplasma is interesting. It's often tied to the more chronic, lingering cases of pneumonia, and it can also cause otitis media.
Otitis media. That's an ear infection, right? In the middle ear.
Exactly. A really painful complication you sometimes see alongside the chronic pneumonia with Mycoplasma.
Hmm.
2, the calf's resilience, immune status and vulnerability.
Okay, so we've got these external threats, the viruses and bacteria opening the door. But what about the calf itself? Its own ability to fight back? How much does that play into it?
Oh, it's huge. Absolutely fundamental. You could argue it's the single biggest factor, really. The number one thing impacting a young calf's immune system is whether or not it got enough high-quality colostrum, that first milk. If they don't get enough or if the quality isn't good, they suffer from what we call failure of passive transfer, FPT.
Failure of passive transfer.
Yeah, it just means they didn't get enough of those vital maternal antibodies transferred from their mother through the colostrum. They basically start life without that borrowed protection.
You mentioned something earlier about an immune gap. Can you explain that? When are they most at risk and why?
Yeah, absolutely. There's this critical window, usually between about 2 and 4 months of age, when calves are particularly vulnerable. What happens is the passive immunity they got from the colostrum, those maternal antibodies, they naturally start to decline. They wear off. But the calf's own immune system isn't quite fully developed yet. It's still learning, still maturing. It's not ready to completely take over the protection job.
So they're caught in the middle.
Exactly. They're in this sort of immune valley or gap.
Yeah.
The borrowed immunity is fading. Their own isn't fully up to speed, making them much more susceptible to any pathogens they encounter.
3.
Environmental and management stressors. The unseen threats. So beyond the bugs and the calf's immunity, we absolutely have to talk about stress in the environment. These things massively increase susceptibility. Think of it like, well, constantly poking at their defenses, wearing them down, making it harder to fight when an actual infection comes along. Housing is a big one. Poor ventilation, for instance. If the air isn't moving, moisture builds up, pathogens can concentrate.
High humidity too, I imagine.
Oh, definitely. High humidity, overcrowding too many calves packed in, and direct drafts are all major risk factors. Plus, poor ventilation can lead to a buildup of noxious gases like ammonia from urine and manure. Ammonia directly irritates the respiratory tract, making it easier for infections to start.
So the physical space is critical, but you also mentioned management practices, things we do.
Absolutely. Things like weaning, separating calves from their mothers, or milk that's inherently stressful. Transport's another big stressor. Castration, dehorning, even just mixing groups of calves that haven't been together before. All these events trigger a stress response in the calf, which directly suppresses their immune function, makes them way more likely to get sick.
And temperature. Does that play a role?
It does. Calves are pretty sensitive, especially to cold, damp, humid conditions. Sudden swings in temperature are also tough on them. It just forces them to use more energy to stay warm, leaving less energy for their immune system to fight off disease. 4. A specific and dangerous form. Aspiration pneumonia.
Okay, this is all painting a clear picture of the common causes. But you mentioned another type, aspiration pneumonia. This one sounds different, maybe not following that typical virus then bacteria pattern.
That's right. Aspiration pneumonia is distinct. It happens specifically when foreign material gets inhaled into the lungs. We're talking milk, maybe rumen contents if they regurgitate, even medication sometimes.
So it's more of a mechanical issue, something going down the wrong pipe, essentially.
Exactly. It's often linked to how they're fed, especially if it's done improperly, like bottle feeding too fast or forcing milk with a tube feeder incorrectly. But it can also happen if a calf has dysphagia, that's difficulty swallowing, or maybe a problem with their esophagus, their food pipe, regurgitation, vomiting. Those can lead to it. And sometimes underlying neurological or muscular problems that affect the swallowing reflex. I remember a case, perfectly healthy calf otherwise, but the owner was just trying to feed it too quickly with the bottle. Led to severe aspiration. Just shows how technique matters.
So that material gets into the lungs. What happens then? What kind of damage are we talking about?
Well, as soon as that foreign stuff hits the lung tissue, it causes direct irritation. Mechanical irritation and inflammation starts almost immediately. And because that material, especially milk or rumen contents, isn't sterile, it often brings bacteria along with it, leading to a very rapid secondary bacterial infection. What makes it particularly nasty, though, is the potential for chemical injury. If, say, stomach acid from rumen contents gets inhaled,
Ooh.
yeah, that acid can cause severe chemical burns in the lung tissue. It dramatically worsens the damage and can lead to something called necrotizing pneumonia.
Necrotizing, meaning the tissue dies.
Exactly. The lung tissue actually starts to die off and break down. It's a very, very severe outcome. V, diagnosing the disease, what to look for and how to confirm.
Okay, so whether it's infectious or aspiration, catching it early seems absolutely vital, both for treating the sick calf and stopping it from spreading. So for someone listening, what are those first signs, the things they absolutely need to be watching for?
Right. For the typical infectious pneumonia, it often shows up in two ways. Acute, meaning sudden and severe, or chronic, more slow and lingering. With acute pneumonia, the first thing, often the very first sign, is a raised temperature. Anything over, say, 39.5 Celsius, which is about 103.1 Fahrenheit. And it's crucial to know this fever can show up 12, even 72 hours before you see other obvious signs.
Wow, that early.
Yeah, so temperature checks can be really useful for early detection. Then you'll start seeing dullness. The calf just isn't bright and alert. They go off their feed. Maybe their head is drooping, coughing, obviously, an increased breathing rate, maybe some effort to breathe, and nasal discharge. It often starts clear and watery, but then tends to get thicker, more pus-like, yellow or greenish as bacteria get involved.
Okay, that's the acute form. What about chronic? How does that look different?
Chronic pneumonia is sneakier. It comes on more gradually. These calves, they might actually keep eating reasonably well, which can be misleading, but they'll often have this persistent, maybe dry cough, a slight nasal discharge that this doesn't clear up. And the really telling sign is poor growth. They just fail to thrive, don't put on weight like their pen mates, they look stunted.
And for aspiration pneumonia, given that it's caused differently, are the signs distinct?
Yes, usually quite distinct and often very sudden. You'll see a rapid onset of dyspnea that's noticeable difficulty breathing, Real respiratory effort. Coughing is common, sometimes a frothy nasal discharge because of the fluid in the lungs. And if a vet listens to their chest with a stethoscope that's auscultation, they might hear these gurgling or rattling sounds, indicating fluid where there should just be air. In really bad cases, you might see cyanosis.
Cyanosis, what's that?
It's where their gums or tongue take on a bluish tint. It means they're not getting enough oxygen into their blood. It's a sign of severe respiratory distress. So seeing those signs points towards pneumonia, but getting a definitive diagnosis, well, a vet exam is really essential. Especially in an outbreak situation, laboratory testing is super valuable. You want to know exactly which viruses or bacteria you're dealing with? Vets can take samples, like deep nasopharyngeal swabs, or even do a bronchoalveolar lavage.
A lavage, like a wash.
Yeah, exactly. It's like a targeted washing of a small part of the lung to collect cells and microbes directly from the lower airways, kind of like rinsing a surface to see what's on it. Those samples go off for culture, see what grows, and sensitivity testing to see which antibiotics will work best. Imaging is also incredibly useful now. Thoracic ultrasound, chest ultrasound, it's non-invasive, easy to do on the farm, and it's brilliant for spotting lung consolidation.
Consolidation, where the lung gets solid.
Right, where the air sacs fill up with fluid or inflammatory cells, making parts of the lung dense instead of spongy. Ultrasound is great for picking that up, even subclinical cases before the calf looks really sick.
Right.
X-rays, radiography can also be used. They give a good overview of how much of the lung is affected, show inflammation, maybe even abscesses. For really critical cases, blood gas analysis can tell us about oxygen levels. Hypoxemia means low oxygen or carbon dioxide levels. Hypercapnia is high CO2. And unfortunately, if a calf doesn't make it, a necropsy, a post-mortem exam, gives the final answers. You can see the damaged lung tissue directly, those consolidated dark red or gray areas, abscesses, or the necrotizing lesions we talked about with aspiration. 6. Treatment strategies, fighting back against pneumonia.
Okay, so you've got the diagnosis. Treatment sounds like it needs to be fast and pretty aggressive to avoid that permanent lung damage. What does it typically involve?
Absolutely. Time is critical. The core treatment usually has a few parts. First, antibiotic therapy. This is vital for tackling those secondary bacterial infections. And it's really important to use the right antibiotic at the correct dose and for the full duration prescribed. Not just for the calf's sake, but also to help prevent antimicrobial resistance, which is a huge global issue.
Right, using them properly.
Exactly.
Yeah.
And generally, for sick calves, we prefer injectable antibiotics rather than oral ones. If a calf feels unwell, it might not eat or drink enough to absorb oral meds properly. There are several good options vets might use. Drugs like florfenicol, telathromycin, ceftiofur, and rofloxacin. The choice depends on the likely bacteria and sensitivity results if you have them.
So antibiotics target the bacteria, but you mentioned the calf often feels miserable, the fever, the inflammation.
Right, and that's where the second key part comes in. Anti-inflammatory drugs, specifically NSAIDs, non-steroidal anti-inflammatory drugs. These are used alongside the antibiotics. They don't kill bacteria, but they do a crucial job reducing the fever, the pain, and importantly, the inflammation within the lungs.
So that helps them feel better.
Massively. Reducing the fever and pain improves the calf's whole demeanor. They feel better. They're more likely to start eating and drinking again, which is critical for recovery. It really speeds things up. Common examples are fluniximab or meloxicam. Then there's supportive care, just as vital. First, isolate sick calves. Keep them away from healthy ones to stop the spread. Really focus on keeping them drinking milk. They need that energy. Provide extra hydration if needed, good nutrition. Supplemental oxygen can help in severe cases. And make sure their environment is clean, dry, warm, but still well ventilated without drafts. Basically make it as easy as possible for them to recover.
And for aspiration pneumonia, given the cause, is the treatment strategy different?
The principles are similar, but maybe with more urgency on certain aspects. Immediate antibiotic therapy is usually recommended because the risk of nasty bacterial infection from that inhaled material is so high. Anti-inflammatories are definitely used too to combat that intense lung inflammation. And in severe cases, if there's a lot of material inhaled, a vet might need to perform suction or even lavage of the airways, carefully flushing them out to try and physically remove the aspirated stuff. That can be a critical life-saving step sometimes.
The best defense.
This all really highlights why prevention is so crucial. It seems like the best strategy by far. And based on everything we've discussed, it sounds like it rests on, what, 3 main pillars?
That's a perfect summary. 3 pillars. Pillar 1, build the calf's immunity. And the absolute cornerstone of this, the most important step, is colostrum management. We cannot stress this enough. The goal is for every calf to get about 10% of its body weight in good quality colostrum. So for an average calf, maybe 3 to 4 liters, ideally within the first 2 to 6 hours of life. That window is critical for absorption.
Non-negotiable, really.
Pretty much. After colostrum, strategic vaccination plays a key role. Using vaccines against the common viral culprits like BRSV, PI3, IBR, and maybe even BVD, and against bacterial pathogens like Mannheimia. This helps reduce the chance of getting infected, and if they do get infected, it usually makes the illness less severe. Timing is important, though. Vaccinate before high-risk periods like moving them into group housing or transport so they have time to build immunity.
Okay, pillar 1 is immunity.
Right.
Pillar 2, you mentioned stress reduction earlier.
Exactly. Pillar 2, reduce stress. Because we know stress weakens the immune system. So, practical things. Implement gradual weaning methods instead of abrupt separation. Try hard not to stack stressors. Don't wean, transport, and dehorn all in the same week, for example. Spread those stressful events out. Give the calf system a chance to cope and recover between them.
Makes sense. Immunity, less stress. What's the third pillar?
Pillar 3, minimize pathogen exposure. Reduce the number of bugs the calf encounters in the first place. This comes back to housing. Ventilation is absolutely key. Need enough airflow to remove moisture, ammonia, and airborne pathogens, but without creating cold drafts directly on the calves. Housing and hygiene generally. Clean, dry bedding is essential. Deep straw beds are great. Avoid overcrowding, give them enough space. And managing age groups is important. Ideally, keep younger, more vulnerable calves separate from older ones who might be carrying diseases. An all-in, all-out system for group pens is a fantastic strategy if you can manage it.
All in, all out.
Yeah, it means you fill a pen with a group of similar-aged calves, raise them in that pen, and then empty the entire pen completely. Then you thoroughly clean and disinfect it before the next group comes in. It breaks disease cycles, prevents pathogen buildup.
All right, stopping carryover between groups.
Precisely. And finally, under minimizing exposure comes biosecurity. If you're bringing new animals onto the farm, quarantine them. Keep them separate for, say, 2 to 3 weeks to make sure they're not bringing in any new diseases before they mix with your main herd. Oh, and specifically for preventing aspiration pneumonia, ensure proper feeding technique. Correct bottle angle, nipple flow rate that's not too fast. Monitor calves closely for any signs of difficulty swallowing or spitting up milk.
Looking ahead.
So, if a calf does get pneumonia, what's the likely outcome? The prognosis? Well, for the typical infectious pneumonia, if it's caught early and treated properly with the right antibiotics and supportive care, the prognosis is generally fair to good. But, and this is important, even calves that recover might suffer long-term effects. They might have some permanent lung damage that affects their growth rate, or later in life, their milk production or reproductive efficiency. They might just never quite reach their full potential.
So recovery isn't always a complete return to normal.
Not always, unfortunately. For aspiration pneumonia, the prognosis is often more guarded, ranging from guarded to poor. It really depends on how much material is inhaled, what it was, and how quickly treatment was started. The lung damage can be very severe, very quickly. Early, aggressive intervention definitely improves the chances, but it can be touch and go.
Wow. This deep dive really underscores just how multifaceted calf pneumonia is. It's not simple. It's this complex interaction of bugs, the calf's own system, and the world around it. It demands a really holistic view, doesn't it? You can't just focus on killing one bacteria. You have to think about ventilation, stress, colostrum, everything.
That's exactly it. Knowledge of all these interacting factors really is power here. It highlights why proactive management, focusing on prevention through immunity, stress reduction, and environment, is so much more effective and ultimately less costly than just reacting when calves get sick.
So, thinking about all this, so what does it mean for you listening? It's interesting to consider how these core principles, minimizing stress, managing the environment carefully, actively boosting immunity, how critical they are for these vulnerable young animals. Makes you wonder perhaps how those same principles might apply in other areas of health, maybe even our own resilience, well beyond the farm gate. Something to think about.